Hey, it's Dr. Birchler. What I'm going to show right now is kind of a indication of what the region of the problem is in the lower spine when somebody's having sciatica. A lot of people use the term sciatica when they're having pain here, and that may or may not be sciatica, but pain that goes down the leg, technically to the foot, in doctor speak, is generally called sciatica. And that is indicative of a problem in the lower back. Some people might have a problem in the back, and depending on which nerve is affected, it might only go to the upper leg. It might not really go down to the leg or the foot, but a lot of times it does. I'm going to show you there are 3 nerves that go down to the foot, and if you have this pattern there, it may indicate where the problem is in the spine. So some people, probably the most common thing when somebody has a disc problem or issue in their back is they get pain in their back, and it goes kind of into their buttock. They'll commonly call it their hips, and it may go down the side of the leg and then into the calf area here, and it might seem like it comes into most of the foot and into the toes. So a lot of people say it hurts in the top of my foot or my ankle and in my toes. When you get specific, a lot of times it's the middle toes and or the big toe, or maybe both. And that nerve is called L5. That's the most common area to have a problem, and it's usually right the second disc from the bottom or the last one from the bottom is the area that's affected there. Now, sometimes the pain will go straight down the back of the leg, straight down the back into the calf. It may go into the heel or the foot, and if it does, it may come towards the little toe side of the foot, like out here or at the bottom of the ankle. That nerve is called S1, and that is usually from a disc herniation at the very bottom, the last disc or cushion in the spine, right around the belt line area. Less commonly, but we do see sometimes the pain will come out of the back and go into the kind of the rear end or hip area. It may go more towards the front of the thigh here. Some people will feel like they have knee pain with this, and it may go more towards the inside of the shin. And if it goes to the foot, they might really feel like their big toe hurts or their ankle hurts somewhere in here. But it distinctly can go to the big toe side of the foot. So if you're having an issue with back pain, hip pain, you're getting symptoms into the legs or feet, that can be from disc problems in the lower back, typically one of the bottom 2 or 3 discs of the spine. If you have any trouble with that, have questions whether we can help you, give us a call here and we'll do a thorough evaluation to see if we can help.